Have you ever wondered, how long should I wait before getting pregnant again? Maybe you're holding your newborn and already thinking about number two, or maybe you're exhausted, overwhelmed, and wondering if you're running out of time. As a maternal fetal medicine physician and mother of four, I get this question all the time. And the answer is it really depends, not just on your age, not just on fertility, but on your recovery, because pregnancy and birth place enormous demands on the body. Today, we're going to talk about what the research shows, who may benefit from waiting longer, and how to know when your body may be ready for another pregnancy. I'm Dr. Jessica Poland, a maternal fetal medicine physician, and this is Vital Femme MD. So what is the interpregnancy interval? Doctors use a term called interpregnancy interval. That's simply the amount of time before giving birth and conceiving again. This is different from the age gap between your children. So for example, if your babies are exactly 2 years apart, you actually conceived when your first child was about 15 months old. That means your interpregnancy interval was 15 months. So what is the ideal timing? For most women, the sweet spot appears to be somewhere between 12 to 24 months after delivery before conceiving again. And the question is why? It's because your body is still rebuilding after pregnancy. And if you're breastfeeding, your body is continuing to prioritize milk production while trying to replenish itself at the same time. What happens if the pregnancies are too close together? Pregnancies that occur less than 6 months after delivery can be normal, but are associated with higher risks of complications, including preterm birth, low birth weight, growth restriction, maternal anemia, increased maternal exhaustion, and nutritional depletion. The body simply may not have had enough time to recover. Think of it like training for a marathon. You can run another marathon the week after you finish one, but your performance and recovery probably won't be optimal. Pregnancy works much the same way. What about women who are over age 35 to 40? And this is where the conversation becomes more individualized. When you're 25 years old, waiting 2 years may feel really easy, but when we're 39 or 40 years old, the equation really changes. You wanted to be pregnant yesterday. We all know that fertility naturally declines with age and miscarriage rates increase. The time available to build your family may be a little bit shorter than it was when you were in your 20s. In these situations, many women and their physicians decide that a shorter interval may make sense. This becomes a risk-benefit discussion. The goal is not perfection. The goal is balancing recovery with your reproductive goals. And what about after a C-section? This is one of the most common questions I receive in my clinic. For women with a prior cesarean delivery, many experts recommend waiting at least 12 months before conceiving again, with longer intervals often preferred when possible. This allows for optimal time for the uterus to heal in the area of the scar. Short intervals after cesarean delivery have been associated with an increased risk of uterine rupture during labor and may increase the risk of placental complications such as accreta in future pregnancies. Again, every situation is different. The type of incision, the number of prior cesareans, and your plans for future delivery, they all matter. So how do you know if your body is ready? Instead of asking only, is my uterus ready? I encourage women to ask, A, am I healthy enough to thrive in another pregnancy? Some questions to consider. Has your energy returned? Are you sleeping reasonably well? Have you corrected anemia and nutrient deficiencies? Are you exercising regularly? Have you regained strength and muscle mass? Is your mental health stable? Are you mentally and emotionally ready to have another baby? Have you addressed pelvic floor issues or bladder symptoms? And are you entering pregnancy stronger than last time? Because the healthiest pregnancy often starts long before that positive pregnancy test. There are 5 things you can do before trying again to optimize your health during a future pregnancy. Number 1, check your iron levels and address any anemia. Number 2, optimize your protein intake and nutrition. Number 3, build strength through regular exercise and walking. Number 4, prioritize sleep, stress management, and erosional recovery as much as possible during this season of life. 5, schedule a preconception visit to review your medications, medical conditions, and pregnancy risks. Think of this time period as training for your next pregnancy rather than just simply waiting for it to happen. So here's the bottom line. For most women, waiting about 12 to 24 months before conceiving again offers the optimal recovery time. It's an excellent balance between recovery and pregnancy outcomes. But your story matters and it's unique. Your age matters, your fertility matters, your previous pregnancy experiences matter. And perhaps most importantly, your health matters because motherhood isn't just about bouncing back, it's about rebuilding forward. If you're wondering whether your body is ready for another pregnancy, you can start with my free postpartum depletion quiz. Many women are told that they're cleared at the 6-week postpartum visit, but they still feel exhausted, foggy, overwhelmed. The quiz can help you identify whether postpartum depletion may still be affecting your health and your recovery. You'll find the link in the description below. And if you're ready for a deeper, more personalized plan, I'd love to support you through Vital Femme coaching. Through my physician-led coaching program, I help women from preconception to 3 years postpartum optimize their energy, health, and prepare for future pregnancies with confidence. Until next time, mama, take care of yourself. I'll see you in the comments.